My name is Daria Smith. I'm the Executive Director of the Connecticut State Independent Living Council. Many of you are probably not familiar with the council. It's a federally mandated statewide planning organization that develops activities, funding opportunities, and resources to support independent living for people with disabilities, and we partner with the Centers for Independent Living. So I'm here today on behalf of the State Independent Living Council to express our grave concern that the Centers for Independent Living are once again proposed for elimination from the state budget. As many of you know, we have many people here from the centers, consumers, staff, board members. We have Silk members here. Our centers are throughout the state. They're located in Hartford, Norwich, West Haven, Naugatuck, and Stratford. And they currently serve all of the states that you see on the top part of the map. Our centers are community-based, they're non-residential, they're consumer-controlled, and they're cross-disability. And they follow the very important independent philosophy of self-help, self-reliance, and self-determination. Once again, our centers currently, with the funding that we have, cover all of the cities and towns in Connecticut. Unfortunately, with the proposed state funding elimination, we will be reduced to the bottom part of the map, which means that our centers would go from serving 169 cities and towns to 25. And that is certainly something that we don't want to see happen. Our centers serve individuals of all ages with all types of disabilities, and they work with people with disabilities by assisting individuals with advocacy to control one's life, developing lifelong independent living skills, connecting individuals to appropriate technology to support their community living. They provide benefits counseling. They help individuals access health care, community supports, recreation, transportation, and any other resource or services that will help them continue to live independently and in the community. They also help consumers develop job readiness skills and access employment, and they help find housing. We urge the continued full funding of the centers as they're vital nonprofits that generate self-sufficiency. They seek to keep individuals out of hospitals and institutional settings, and they promote the quality of life. After decades of underfunding, the centers will be faced with layoffs and service reductions. And again, you can see one of the substantial service reductions that we're talking about, in addition to, with this reduction, individuals will likely be waiting for services. With that, I would like to introduce Representative Abercrombie, who is an ongoing advocate, supporter, and friend of the disability community and of the Centers for Independent Living in particular. Representative Abercrombie.
Thank you. Good morning, everyone, and welcome to the state capitol. For those of you that this is your first time, I hope you enjoy your experience here. You know, Connecticut is in a really tough position, but we can't balance the budget on the backs of those less fortunate. We are working on our budget right now. The budget that you have seen out there, which is the governor's budget, is not the budget that we are proposing, so I can tell you that much right now. But I have to be honest with you. You know, we do need your help with this budget. We can't stand here today and say there aren't going to be any cuts, because we've got a $920 million deficit, and it's not going to be easy. But I can tell you that you have a lot of support in this building. We understand that you're a lifeline. We understand that you provide services that if you're not around, individuals will not have. So you have our support, but more importantly, you have our gratitude as a state, because we can't do it without you. So thank you, really, for being here today. Our colleagues will be starting to come in any minute, so please take the opportunity to introduce yourself and say hello, and thank you again for being here.
I would like to next introduce Senator Markley, who is my state senator and has also been another great advocate and supporter of the Centers for Independent Living. Senator Markley.
Thank you, Daria. It's funny. I think we met when I was knocking on doors, as a matter of fact. And one of the reasons I support this is because I know both people who are involved in from the administrative side and people who have received the services. And I'm convinced that this has been a very, very effective program that's given a lot of help to people at very low cost to the state, and has also helped the state avoid costs that it otherwise would incur if these centers didn't exist. And that's one of the reasons that I think that preserving this funding is so significant. Kathy Abercrombie, who is another person who has just been a delight to work with on the Human Services Committee these last few years, and who both has a wonderful heart and concern for people, and yet a very practical mind to approach things and get them done the way they need to get done, and a very open and a great openness to ideas and to working with others. But she said that we're in tough times, and that's true. It's hard to imagine that they could be more difficult. That said, I think that we run the risk of being penny wise and pound foolish in cases like this. That reductions in services here could turn into expenses which are tenfold greater elsewhere if people are forced into care that is greater than what they're currently receiving, that is worse from the point of view of their lives and more expensive to the state simultaneously. Really, I think that's the worst of all worlds. I feel like that's one of the reasons I've always been talking about finding savings in the budget. I think that we need to look within ourselves, which is to say within the state government itself, and find savings there, and not try to cut off the support that we provide to the nonprofits and to other service providers who we have had on a strict diet for a long time. I don't think there's a lot of fat left on them, and I think that we need to at least help them have as much as they've had to keep going. I'm absolutely delighted. I will share. I'll say Kathy makes a good point in thanking you for what you do. We're up here and we make decisions, and I get thanked for doing this, and I think this is not the job to thank people for. It's the people that are actually in the trenches providing the services who deserve our gratitude. And I am grateful for what you do to improve, really the greatest thing that we can do to improve the quality of another human being's life. And keep up that good work, and we will do our best on this end to make sure that you have the resources to continue to do it. Thank you.
Thank you both. You're great friends and great tireless advocates. I would like now to introduce Bob Gorman, who started off as a consumer and is now helping consumers live independently and access resources and live as independently as possible. Bob? Podium's right here.
Hi, good morning. My name is Bob Gorman, as Daria said. I live in Torrington. 20 years ago, I lost my eyesight within 30 days from problems from diabetes. I had 4 operations. Obviously, they were unsuccessful, and I really didn't know what to do. At the time, before I lost my sight, I was working as a financial analyst and realized that was something I could no longer continue to do. So not knowing what to do, I contacted my local Center for Independent Living and asked simply, what type of jobs, in your guys' experience, do blind people do? And within 2 days, they set me up a counselor to talk to me. And within a week, I was down meeting with my executive director, who is still with us today, and I was actually offered a bookkeeping job. Now, I'm asking the same questions as you're probably thinking. How could a blind guy do bookkeeping with numbers? And I was informed that through assistive technology, in my case, screen readers, that I could do it. So I practiced on it, and then they, through their help, also arranged how do I go from Torrington to Naugatuck, and they assisted me with the transportation. So through them, I found information that I really didn't know. And I've been there now 18 years working there, and I never imagined when I went blind that I would be able to do that. I felt very, very fortunate, and I feel very fortunate to stay because I have the ability to work with people who I know desperately rely on our services. For almost 25 years, our center has helped probably the most vulnerable and fragile population here in Connecticut, those people who are disabled or aging. And it's a very, as you all know, it's a very complex system for these people to navigate, let alone for anyone else to navigate. So I can say that through the years, I know our center and I know all the other centers here in Center for Independent Living here in the state have helped people find safe and affordable housing, provide transportation like I do. It's not perfect, but it is transportation. We do both individual advocacy, as Daria stated, and we do system advocacy. We also assist people with applying for state and federal benefits that they need. And more importantly, we, through transitional coordinators we have at our centers, work under the Money Follows the Person program. Now, as you probably don't know, that the Money Follows the Person program transitions people from nursing homes to live in the community. That alone saves the state of Connecticut millions and millions of dollars in Medicaid costs. We also assist the school systems and parents and the students themselves in transitioning out of high school for people with disabilities. We teach them and we find them, first of all, how to do a resume, how to do a mock interview, how to actually apply for a job, and actually how to get a job. We also, if they want to continue with education, we help them, hook them up to the resources that would be available to them to help them through their education process. And if people don't want to go to school and want to continue until 21 in high school, then we find appropriate programs for them to do that will help them maintain their life going forward to be independent as much as possible. It is vital, vital, vital that we receive some type of funding. I understand we have going through a hard time, but the Centers for Independent Living desperately, desperately need the funding. And I would appreciate any assistance that the legislature could give us. Thanks very much for listening to me. Thank you.
We're going to have to play a little musical chairs. Nikifa, who's on your left, is going to come up and speak next. Thank you, Bob. And I failed to mention that one of the most important pieces of Centers for Independent Living is that they're staffed by people with disabilities and working with people with disabilities. Their board is made up of people with disabilities. So that's a very key, unique approach to the way the centers are managed and the way they provide services every day. I would now like to introduce Nikifa Rose, who has been working with our center in Stratford, Access Independent, and she's going to tell us a little bit about her story and her work and advocacy with the center in Stratford. Sorry. I think that's as far down as it goes. Hold it. Thank you.
Good morning. At the age of 17, I was paralyzed from a porch collapsing underneath me. It was a hard time for me because my grandmother at the time didn't really have accessible living for me, so I had to move to the state of Florida. Probably in November of '95, I had to move to Florida and live with my older sister. While living in Florida, I came upon the Miami Projects, and they were an establishment that wanted to help people like me with disabilities find a cure for paralysis. It was an experimental treatment, but I wanted to go through with it because I felt like that's what I needed to do. After about 10 years, I had to come back to Connecticut, and I ended up living with my twin sister. And for 2 years, I was confined to a second floor apartment. It was crazy because I got depressed. They got to go out, and I didn't get to go out. After maybe a year, Habitat for Humanity came into our life, and we were granted an accessible house. In '06, we moved into our house, and I felt a weight lifted off of me that no one can ever believe. A couple years went by, and I was still depressed because I didn't have the resources that I needed to help me live an independent life. I'm an independent person, and I like to go out, and I like to do things, but for a long time, I didn't have access to wheelchairs because I didn't have insurance. And when I stumbled upon, I went on the internet one day, and I was just determined to find someone that can help me with my situation, because my sister was helping me, but it was only so much she can do because she's a single parent, and I didn't want to add to the stress of her having to work extra hard just to make sure I had what I needed. I felt like I was another child, and we're both the same age, so I wanted to be an independent adult. After I came across this program called the NEAT program, I drove to Hartford to try to find better equipment for myself because I was outgrowing the wheelchair that I had, and I didn't have any insurance to afford a new wheelchair. So I went to the NEAT program, and they in turn led me to Access for Independence. And when I tell you my life has been changed, like depression, what is depression now for me? I'm happy. They've helped me. They continue to help me. And I feel like if you guys cut funding from this organization, where are the people like me going to go when we need counseling? Where are the people like me going to go when we need jobs? Where are the people like me going to go when we just want to be independent and we want somebody to hear our voices? These are the people that have helped me. And if I can speak up and help someone else become independent, that's what I'm going to do. And that's why I'm here, because I know there are a lot of us in the world who need the Center for Independent Living. And if you take that away from us, where will we go? We will have to go out of our reach to get to one facility to the next. That's not fair to us, because we are already limited when it comes to transportation, when it comes to everything. We're already limited. So why limit us when we need Centers for Independence, when we need access independence? These people are our backbones. And if you take them away, who do we have? Who do our families have to help us? And that's basically why I'm here today, to make sure that you guys don't take away the people that support me, because depression is not a good thing. And I don't want to be in nobody's mental institution, because my mind is clear and I'm very capable of taking care of myself. As long as you guys don't take away the centers that help take care of me, I'll be fine. And that's all I have to say.
Thank you, Nikifa, for sharing your story and for your passion and for being a fabulous advocate. I would now like to introduce Senator Kennedy, who also, along with Senator Markley and Representative Abercrombie, is one of our great friends and advocates and ongoing supporters for the Centers for Independent Living. Thank you.
Well, thank you. It's so great to see so many incredible advocates here in Hartford once again to talk about a key issue that we face in our society, which is independent living. It's the cornerstone of the disability rights movement, is the concept of independent living, self-determination, equality, and dignity for all people. That's why I'm here. I see my good friend Mark Anthony Gallucci here. I've been to Mark's Center in West Haven. I know the important work that the Centers for Independent Living do each and every day on behalf of people with disabilities. And I know that if we're going to achieve equality in our state and in our country, we need to strengthen, not eliminate, Centers for Independent Living. Now, unfortunately, we're at a point where we need to make an economic argument. Forget about the moral argument. We need to make an economic argument. But you know what? Those of us in the independent living movement can make that argument because we know the important work that Mark Anthony and his colleagues do across the state is to provide people with the resources that they need to lead productive lives. If we're ever going to address the problem of institutionalization of people with disabilities and our senior citizens, we need to have the resources that are provided by Centers for Independent Living to help people get out of institutional care and living independently where they can become productive, tax-paying citizens. Those of you who I've worked with over the years know my personal story. When I was 12 years old, some of you know I lost my leg to cancer when I was 12 years old. And when I was in college, I learned about a movement that is a civil rights movement, not unlike many of the other social movements that have that we've seen in our country in modern times. And I got involved, and I've been on the board now of the American Association of Persons with Disabilities for over 15 years. We are one of the leading disability public policy and civil rights organizations in the United States. So I understand the importance of independent living centers. I want to thank my colleague, Senator Markley, and my colleague, Representative Abercrombie, for joining us here. And we all know that we're facing tough economic challenges, and I'm not quite sure, honestly, how this whole thing is going to work out between now and next week. I'll be honest with you, I don't. But I want you to know that you have some important advocates here who are going to do whatever we can to make sure that these funds are sustained so that the Centers for Independent Living can continue to do their important work for our state of Connecticut. So thank you very much for inviting me to be a part of this occasion.
Thank you, Senator Kennedy. We're honored to have you here in the state and serving us. I would now like to introduce Melissa Marshall, who many of you know as the coordinator of the Cross Disability Alliance. And in a former lifetime, she also ran a Center for Independent Living. Melissa.
Thank you. It dawned on me that I was a center director literally in the last century, but I've been around a while doing that. As Daria said, I'm Melissa Marshall, and I'm the coordinator of the Connecticut Cross Disability Lifespan Alliance, which is a coalition, as the name implies, of disability groups of all kinds. People with physical disabilities, intellectual disabilities, people with mental health conditions and psychiatric disabilities, people with intellectual disabilities, all kinds of people with disabilities. And the I'm here representing them today because the members of the Alliance wanted to have me let you know that the Centers for Independent Living are the lifeblood of the disability rights movement. And as Senator Kennedy alluded, they're what sustains the independent living movement. Centers are at the heart of everything. They enable people with disabilities to live independently, to live outside their parents' homes, to work, and very importantly in this fiscal climate, to pay taxes. That's something everyone wants people to be doing right now. We need to enable people with disabilities to pay taxes. And as budget cuts are made to other agencies like DDS and DEMAS, not that those should be cut either, centers become even more important because centers serve people with intellectual disabilities and people with mental health conditions and needs. That's really, really critical and important. Recently, I was approached by someone who said to me, "Didn't you used to direct one of those centers for independent living?" And I said, "Yeah, I did a long time ago." And she said she was a parent of an adult son with an intellectual disability. She said, "I went to the Disabilities Network of Eastern Connecticut maybe 20 years ago, and there's a board president," and she named the board president. He used a power wheelchair and had an environmental control system before anyone else did, the late Mary Lou Wilcox. And she said she showed us around her house and her farmhouse, and from that experience, I knew that my son with an intellectual disability could live independently. He's now an adult, and they're preparing for him to move out of the home, and he's preparing to have a job. That's what centers do. That's what centers can continue to do. Thank you so much for your time today, and thank you everyone for coming. This is really important.
Good morning. I'm Eileen Healy. I'm the president of the Connecticut Association of Centers for Independent Living and a Center for Independent Living executive director. I want to thank Senators Markley and Kennedy and Representative Abercrombie for being here today and for their ongoing support of Centers for Independent Living. I want to thank Melissa Marshall for presenting on the importance of cross-disability and sharing some of the experiences she had as a center director. And I also want to thank Nikitha Rose and Bob Gorman for sharing their experiences with their local Center for Independent Living. Their success stories are repeated by hundreds of people with disabilities throughout Connecticut as a result of their involvement with their local independent living center each year. In 1987, Connecticut passed legislation to create a network of centers for independent living. The goal was to create a network of 8 centers. In 1988, $600,000 in state independent living funding was appropriated. 28 years later, I'm still here, and so are the centers. There are only 5 centers. We have served the entire state all of these years, and this year the centers are funded at $495,000, and less with the rescission. That's the total funding for all 5 centers. Okay? And now we are proposed for elimination in the governor's budget. Like most entities that help people in need, none of us wants to say no, but something has to give. If all state funding for centers is eliminated, centers will be forced to reduce the numbers of cities and towns we're able to serve to just 25 of the 169 towns in Connecticut. Centers will be forced to institute a waiting list for services effective July 2016, despite an increased demand as other state-funded programs are cut. People will be waiting 6 months to a year for assistance and may lose their employment, housing, and be placed in costly nursing homes and facilities during that time. That will increase expenses for unnecessary nursing home placement, emergency room care, and there will be increased reliance and expense on state benefit programs. Centers will be forced to suspend time-consuming but critical housing services such as housing search and eviction prevention. Centers will have no choice but to lay off staff. Most are people with disabilities, which will increase unemployment compensation costs and decrease tax revenues. And finally, some centers may just close their doors, leaving hundreds of people with disabilities without access to any independent living assistance. The state independent living funds are required for centers to provide cost-effective programs such as Money Follows the Person, a program that saves the state money. According to DSS, the average cost of a nursing facility is $146,000 per year per person. Transitioning people with disabilities out of nursing homes is not only the right thing to do, it also saves the state millions of dollars. In 2015, Centers for Independent Living transitioned 233 people, and many more were prevented from ever entering a nursing facility, saving more than $10.3 million annually. The state spent $522,000 to support the centers, and we returned $10.3 million through Money Follows the Person. That's an amazing return on investment. The state is in dire straits financially, and tough choices must be made. The independent living line has been funded at well under the original $600,000 for many years without increases. Eliminating funding for the Centers for Independent Living is a foolish financial plan because the Centers for Independent Living save the state 20 times what it costs the state to fund us. People with disabilities will not be served, and ultimately this will cost the state more, and far fewer people will maximize their independence. I fear for the future well-being of Connecticut citizens with disabilities. Thank you, and we have a few moments for any questions.